Thank you. Our next presenter is Dustin Pardini, who is an assistant professor of psychiatry and psychology at the University of Pittsburgh. And he's been extensively involved in research on conduct disorders in terms of some of the work he's done there. He also looks at antisocial behavior across the lifespan, especially among boys who tend to exhibit callous and unemotional interpersonal style, which we heard about earlier. He's interested in the applications of innovative statistical methods to address developmental questions related to antisocial behavior. Dustin?
I just got back from Australia a couple days ago, so it's like 3 a.m. for me right now. So if I stop making sense at any point, try and imagine getting up and giving a talk at 3 a.m. in the morning. So I'm going to switch gears a little bit here and talk about prevention of youth violence and what are the current strategies we're using to enroll kids into targeted violence prevention programs, and how well do these strategies work, and what could we potentially do to improve on them. We know that serious violence tends to peak in adolescence, and where a majority of the kids that are engaging in violence will actually desist over time, and there's a small portion of kids that will actually exhibit persistent violence into adulthood. So when I talk about prevention today, I'm really going to be focusing on the elementary school years, where a lot of our prevention programs are targeting kids before they start exhibiting these serious violent behaviors. So currently our approaches to violence prevention in kids involve either universal prevention, where we give an intervention program to the entire population of youth without regard to any individual risk factors that each individual child may have. We have selective programs that target kids that may have some sort of risk factor that's previously been linked to violence, but typically this is not an individual difference characteristic. It's usually something like living in a high crime neighborhood. And then we have indicated interventions, and these actually represent a bulk of the targeted interventions. And these target kids that are exhibiting early forms of violent behavior like physical fighting, or other kinds of problem behavior like oppositional or defiant behaviors. And a lot of these are really targeting things that are consistent with a diagnosis of oppositional defiant disorder and conduct disorder, although they don't necessarily have to meet a criteria for a diagnosis. This is a recent meta-analysis that was conducted, and what you see here in the red, these are effect sizes on aggression for interventions that include indicated, selective, or universal prevention programs. And perhaps unsurprisingly, the indicated interventions produce the greatest reductions in aggressive behavior, and that's because those kids are exhibiting elevated levels of aggression to begin with. And then you see this gradual tapering down, and universal preventions tend to have a very small effect on aggressive behavior, although it tends to be significant. And that's because a lot of these kids actually are not at risk for exhibiting aggression or not already exhibiting aggressive behavior to begin with. So the question comes, which approach is more effective? And there's kind of at least two ideas behind this. One is the prevention paradox that was posed by Rose that says, in general, our ability to identify high-risk individuals that are going to exhibit violence is poor. And that really, if we're trying to identify those kids, we're not going to do a good job. And what we should really be focusing on is reducing the mean risk in the population as a whole. And while that might have a small benefit for each individual, because some of those kids will be at low risk, in the long run, it's going to have a larger impact on violence because we're not missing anybody. Another theory is some call the power of the few, which is based on research that a small number of juvenile offenders actually commit a large proportion of the total amount of crime in adolescence. And that we really should be focusing our resources on those kids and identifying those kids, and that's going to have an optimal impact on the overall volume of crime and violence in adolescence. There's no right or wrong answer. What I'm going to focus on now is the idea that we should be screening kids for these targeted prevention programs, because these programs are currently adopted in society. And so if we're going to do that, we should be doing it well. So just to go over the characteristics of a brief, an effective screening instrument for these types of program, it needs to be brief, it needs to be psychometrically reliable, it needs to be precise in terms of delineating a kid on a continuum of risk, and it needs to be ideally administered across multiple settings. If we're going to do screenings in schools, it should be applicable for schools, but we should also be able to use it in places like pediatricians' offices to give parents feedback about their child's level of risk to make referrals to appropriate treatment providers. It must significantly predict future violent behavior. There has to be evidence to show that it predicts violent behavior. But that is not a sufficient condition, because when you show a correlation, it doesn't mean that that measure can actually accurately classify a kid at risk for violence. And that's where we get into these issues that were discussed previously with sensitivity and specificity in terms of how well is it classifying these youth in terms of their risk for violence. An important consideration there is that as the base rate of a behavior decreases, the amount of false positives that you are going to have is going to increase. So if you have a low probability behavior, any risk screening instrument is going to have a high number of false positives relative to the same risk screening instrument implemented with a higher base rate behavior. And then you also have to consider the practical implications of making certain types of errors. When you determine where am I going to cut the risk assessment instrument in terms of delineating a kid at high and low risk. When you make false positives, you're identifying a kid that's at low risk and you're putting him in intervention. There's a risk there that there could be negative ramifications to that child because of labeling. And there's also a possibility that the intervention might have teratogenic effects on the child's behavior. There's been some studies that have shown, and not consistently, that putting kids, aggregating kids in groups can potentially cause deviancy training when a bunch of deviant kids are aggregated into groups. Deshawn did some work on this, but other studies have found that's not the case. But you have to be aware of that. But also, false positives are going to reduce the cost effectiveness of these interventions. These interventions are expensive. Placing a child in these interventions that's at low risk is essentially wasting money on that child. False negatives, on the other hand, you're overlooking kids that are most in need and they're going to go underserved. And you're also going to reduce the overall impact that that program has on violence, because you're not going to be getting all of the kids that are at risk for future violent behavior. So what are we currently doing now to put kids into these programs? Well, believe it or not, there is no existing standardized, empirically based risk screening instrument that has been developed to refer kids to these programs. There's plenty of risk screening instruments in adulthood. There's a few in adolescence, but there's no risk screening instrument that's available for the general population to identify kids that should be referred to these programs. What we've done is ad hoc procedures for programs like Fast Track, Coping Power, other programs for violence, where they are based on the idea that early conduct problems are the most robust predictors of future violent behavior, and that's been shown in longitudinal studies. So there's various different measures that are used. They're basically rating scales of how much oppositional behavior a kid's exhibiting. Are they lying? Are they engaging in threatening behaviors already in the classroom? But at the time that we adopted these measures, there was no empirical basis supporting how well they classified kids at risk for future violent behavior. Since that time, we've gone back and we've looked at how well these can classify kids using longitudinal data from existing longitudinal studies. And this is just an example, and it's pretty consistent with other studies by some work by a colleague of mine, Hanno Petrus, that looked at the TOCA. So this is a teacher report of conduct problems and how well it classified kids at risk for being arrested for a violent offense in the future. And what he found is, and he looked at grades 1 through 5, each separately. And you could see that the statistics are pretty variable in terms of only about half of the kids are being accurately identified as being at risk for arrest for violence. But there's a large and variable number of false positives. So you have up to 71% of the kids that are being identified at high risk not actually going on to exhibit violence. In girls, the classification is much lower, and this goes back to that issue of base rate. The base rate of arrest for violence in girls is much lower, so you get lower classification accuracy in terms of identifying girls at risk for future violence, but there's also fewer false positive rates. So it's really because there are not that many girls exhibiting violence to begin with. So you really have to pay attention to the base rate issue. And there was some evidence that accuracy was better in the later grades. So it's really not that surprising that we're poorly identifying these kids when we look just at conduct problems, because we know from longitudinal studies over time that these kids that exhibit early conduct problems, a lot of them will desist in their conduct problems over time. So if you look at that green line there, those are kids that started off with high levels of conduct problems in early elementary school, and they tend to desist over time, while only a small portion of them will continue. Okay, so by identifying kids with high conduct problems, you're gonna misclassify because of this desisting group. And then you have this blue line, which is the later onset group. And if you're focusing purely on conduct problems, you're going to miss that group also because they don't have that risk factor. You need to identify something else that's classifying those kids accurately. So I'm going to talk a little bit about what we've done with the Pittsburgh Youth Study to try and identify a better way of doing risk screening instruments that goes beyond just looking at early conduct problems. This is a long-standing study that was started by Rolf and Magda Lober. It started in 1986 and 1987. It sampled kids from the Pittsburgh public schools and oversampled boys in the upper range of antisocial behavior, and then randomly selected a group from the remaining end of the distribution. And then they were followed over time, and they were followed over a long period of time. So each one of those numbers represents a retention rate into the study and an assessment point where we asked them questions about their violent behavior, and we also collected official criminal records for violence across that period of time. The rates of violence in the sample are pretty high and consistent with some of the research that I heard earlier. There's a disproportionate impact of violence on minority youth in our study, both in terms of being a homicide offender, being a homicide victim. It's quite shocking that 1 in 4 of the African American boys have been shot by the time they reach young adulthood, and they also have higher rates of gun carrying. So what we wanted to do is look at all of the risk factors that we had in the study at the first assessment point and determine what are the ones that best predict violence. And we went beyond just looking at early conduct problems to look at family conditions, peer influences, neighborhood characteristics. And there was 51 different factors that predicted the onset of serious violence. So serious violence was rape, robbery, aggravated assault, homicide, or attempted homicide. And then we looked at what were the strongest predictors in a regression, and we identified 11 of those out of the 51. And here is a graph of, as you add up those 11 risk factors, what are the percentage of individuals that are committing violent behavior? And you can see it's a pretty linear relationship. And if you look at the risk factors, they span both academic issues in terms of not being motivated at school. You also have some early physical aggression and being cruel, but you also have things like family poverty and living in a disadvantaged neighborhood and lower SES. So you're getting factors across multiple domains. But still, when we looked at sensitivity and specificity, if you look, I mean, our ability to classify these kids is better than what the adult risk assessment instruments are doing, but we still need to do better. It's still not great. And so the reason why I was excited to come here is I have a grant that's currently under review at NICHD to actually develop a better risk screening instrument. And so this is kind of what our plan is to do that. We have several longitudinal data sets in the United States that have followed kids from elementary school all the way into adulthood. We have the Pittsburgh Youth Study, we have the Pittsburgh Girls Study, we have Fast Track, we have multiple studies. So what our proposal is to take each of those data sets and conduct comparable analysis across them to try and replicate factors measured by both parents, teachers, and the kids themselves, factors that may predict persistent aggression and violence across adolescence. Once we identify those things that consistently predict violence, we're going to work together with experts in the community to develop standardized item content to assess each of those risk domains, because a lot of these measures were never developed for screening. They contain way too many items. Some of these items are wonky. They don't work correctly. They reduce reliability. They reduce your precision to identify kids on a risk domain. And then once we do that item review, we're going to then leverage innovative kind of state-of-the-art psychometric techniques to identify those items that best discriminate kids at the highest end of the risk continuum, and to do it as reliably as possible, but with as brief a measure as possible, and then develop some norms for those risk screening instruments to identify those kids that are at highest risk based on a brief measure that can be administered both at school, in pediatricians' offices, and other avenues, because they'll be developed for each individual informant in terms of teachers, parents, and youth. So that's my little spiel about this project. Thank you for letting me talk and be a little incoherent if I was. Thank you.